Hey everyone, we are back at SC Oncology Associates, other known as SCOA, and today we are diving into pharmacy, which I have some of the team here with me. How are y'all doing today?
Great. How are you?
Doing wonderful.
Good. Please introduce yourselves.
Hey, my name is Michael, one of the pharmacists here at SCOA.
Hey, my name is Eric. I'm the Director of Pharmacy here at SCOA.
And my name's Richard. I've been here at SCOA for nearly 7 years now. It's really just a tremendous privilege and honor, honestly, to work alongside such wonderful partners and to be able to serve the community in such a fundamental way. You know, our patients are family members, friends, neighbors, and so the opportunity that we have to just serve them is just something that's hard to even put into words.
If there's one thing we could say to them, it's like there is a lot of life after diagnosis, and cancer doesn't have to define who you are. So for us to be able to transform them from the first time they get here, and then after a couple of weeks down the road, you get treatments done, you get medications here filled, that you start to see that dynamic shift of, you know what, I have this. And you see a lot of people around them that are fighting with them and for them.
I also saw you guys are URAC accredited. What does that title mean to you guys?
The oral side of our pharmacy has gotten more and more complex. So when I started 19 years ago, there was just a handful of prescriptions that were oral that were treating patients. Now, I mean, there's a lot. And so what URAC has done for us is really put the laser focus on that portion of treatment.
It's a rather strict accrediting body, if you will. There's lots of things that we had to do to even get that accreditation for the very first time. And it's an ongoing process. Like Eric was saying, there are standards that we were held to that maybe even other pharmacies might not be able to obtain. Not trying to brag, but there's a lot of work that goes into the dispensing of oral chemotherapy. And so that accrediting body, URAC, they help us to hold ourselves to the standard that we need to hold ourselves to, not for our own sake, but for our patients.
Now we are in the infusion pharmacy part of SCOA, where you already met Richard a little while ago, but now we have the other team members here. How are you guys doing today?
It's doing great. How are you?
Good. Please introduce yourselves.
Well, I'm Tara. I've been with SCOA 11 years.
I'm Victoria, and I've been at SCOA for 4 years.
Well, there's a lot that we do on an everyday basis. Well before a patient even arrives at the clinic, we are in the infusion pharmacy preparing the medicines that they get even before they get their chemotherapy.
Our biggest thing here is patient safety. And so the pharmacists give us our labels. We double check every single thing, every drug, every patient, make sure everything lines up exactly how it's supposed to be. The pharmacists are absolutely the greatest here at SCOA. I'm gonna brag on Eric and Richard. They keep us, no matter what comes in, you know, we're getting sheets and it tells us everything we need to know, how we're gonna prepare it, ask questions, and there's never, ever a doubt on keeping up with all the new information.
We stick together. We love our patients. We love each other. That pretty much like helps us get through our day, you know. We always put ourselves in the patient's shoes and their families, and that helps us even more. Even the experiences we have with our own families, we bring it here and it helps us, you know, helps us through.
So now we are in the retail pharmacy side of SCOA, which you already met Eric, but we have these two lovely ladies with us today. How are you guys doing?
Doing well.
Good. So please tell me, introduce yourselves and tell me what is your role here at SCOA?
So my name is Jasmine, and I am a pharmacy technician here in the retail pharmacy.
I'm Brittany. I am also a certified pharmacy technician who works under our wonderful pharmacists here at SCOA.
We end up working very closely with our patients. We help them with their treatment. We help them with finances. Whenever they can't afford something, we do our best to help them look for like financial assistance, or even if a lot of them, sometimes they just need someone to talk to and help them they just need our support.
Yeah, so wearing multiple hats in this role.
Correct.
Yeah.
And at the end of the day, we're also somebody else in their pocket for support along the way on this journey. We don't want them to ever leave here feeling like overwhelmed, so to say. We want them to leave with a smile on their face, encouragement. Sometimes they come in here crying and they leave laughing. It's really about just lifting their spirits in the process of things for us.
We're going to take a second to brag on the pharmacy technicians on the retail side because they were the lifeblood of what we do. They really, when oral therapies came out, again, there was like a little handful, now it's a mainstay, and they developed such sweet relationships with our patients. They just do a fantastic job just connecting with the patient and just seeing the patient for who they are, not just a prescription, but a person just kind of going through a really hard journey. And so that's a really unique opportunity, and these ladies just really do an amazing job at doing that.
What are the advantages of having a retail pharmacy on the site?
Yeah, so coordination of care is hugely beneficial having it right here. Having access to all the specialty medications is hugely important, and coordinating with the physicians and the providers of, hey, there's a dose change. Well, we can handle it a lot quicker than having to, phone a mail order pharmacy, right? But having the pharmacy here is great. It's been a huge part of our patient care, and so we've always done what is best and most convenient for a patient.
Thank you so much for educating me on these topics and sharing your stories. They were so amazing and heartfelt. And you guys, there are more upcoming segments here at SCOA, so stay tuned. Also, there's a QR code on your screen where you can scan it. It will take you straight to the SCOA website where you can request an appointment.